All right, these are heart notes number 2 about the external anatomy of the heart. The essential question today is, what structures can be identified on the exterior of a heart? What structures can be identified on the exterior of a heart? All right, so looking at this heart, you can see, and in class we look at real ones, you can see these major vessels that bring blood to the heart. And I'm going to color them blue because we draw blood as blue when it has lost most of its oxygen because the body tissues have used it. And so that's blue blood returning to the heart. And then that blue blood goes in to the inside of the heart, and then on the right side, and then it's going to come back out and go to the lungs. And so I'm going to color this blue as well. Now these structures first that I'm coloring are let's start at the top. So this right here is the superior vena cava, and this right here is the inferior vena cava. Oops, IVC. And so the upper part of the vein that brings blood to the heart from the body is the superior vena cava, and the lower part is the inferior vena cava. Inferior means above, or sorry, superior means above, inferior means below. Those are words you see all over the place in anatomy. And so there's an inferior and a superior. They come together in this chamber here that you're going to learn about later. Now that blood goes through the right side of the heart, and the right side of the heart pumps blood to the lungs. And so this blood comes into the right side of the heart so that it can be pushed further along to the lungs. And so I'm going to write lungs here. And the lungs are able to add oxygen to the blood in large amounts. This would be the inferior vena cava on this side, and this would be the superior vena cava. This is, just give you a little perspective here. This is the front of the heart as it would sit in a person's chest if you were looking at them facing you. This is the back of the heart. And so this is an anterior view. And this is a posterior view of the heart from behind. So the vena cava's going in there. They've removed a big chunk of the inferior vena cava that's here that isn't here, okay? And so this is going to be IVC, inferior vena cava, and superior vena cava. Now, I'm going to use red. Well, I don't have red. I have a pink highlighter. So I'm going to use pink for the blood coming back. So the blood comes back to the heart from, oh, I didn't tell you what these other things were called yet. This right here is called the pulmonary trunk. And the pulmonary trunk comes right out of the right side of the heart, and then it splits and goes to the lungs, to the left and to the right. This is the left side of the heart. This is the right side of the heart. It's not in relation to the way it looks to you. For me, this is my right side and my left side, but it's relative to the person. So inside of the person's body, this is their left side, this is their right side. And so the left pulmonary artery goes this way, the right pulmonary artery goes that way. And so here are those pulmonary arteries coming off the pulmonary trunk right here, going to the lungs. And so I'm just going to write pulmonary artery, there's a left and a right. Okay, so the vein, that's an artery. So veins, as you learned about last time, take blood to the heart, arteries away. So the pulmonary artery is the vein that takes blood away from the heart. This is the only artery with deoxygenated blood. Most arteries have bright red blood. When the blood comes back from the lungs, wrong color. When the blood comes back from the lungs, it comes back in through the pulmonary veins. These are the only veins in the body that have bright red oxygenated blood. So these are the 4 pulmonary veins, and they drop into the left upper chamber of the heart. So those are the pulmonary veins. They're coming from the lungs. So this is lungs filling the blood with oxygen, and the blood comes back to the heart. Those are called pulmonary veins. PV, pulmonary veins. Looks like P check mark. Okay, and so the veins that bring blood to the heart from the lungs, the only red vein in the body is the pulmonary vein. And then from there, the blood goes into the left side of the heart and it fills up this chamber, goes down, and then shoots out the top. And this goes to the head and to the, actually that goes to the, mostly the right arm. This goes to the head, that goes to the left arm. And something branches. This one you notice is twice as big as those two, and this one splits and has another one come off to the head. And so all of these are coming off of this vessel here called the aorta. And so the aorta is the major artery of the body. And there it is from behind, right there. It is the thickest artery you've got. And so, whoops, talking to myself, I guess, because you couldn't see what I was saying. And so that is the aorta. The artery that takes blood to the body is the aorta. And so this right here, I'll just put an A here, the big artery, the aorta. All right, now the last thing that I want to color is the right at the base of the aorta. So kind of like if you could nudge yourself in right there, and if you could nudge yourself in right there, you'd see these 2 arteries that come out of the aorta. The very first thing that the blood feeds is the heart muscle itself. And so there's all these arteries coming off of the aorta, these 2 major arteries that come off the aorta, and that even wraps around the heart. So here it is wrapping around and it keeps coming. And I don't know what's blue and what's red here, but some of it's blue and some of it's red. And so this is called the circumflex branch of this, and this is the left branch, and that's the right branch. And all of these branches that I just colored red are called coronary arteries. And coronary arteries seem insignificant, like, yeah, it's just some arteries on the surface of the heart, big deal, what's the big deal? Those arteries, if they get blocked, especially if they get blocked fairly high up, that blockage causes a death of the heart muscle. And so a blockage equals myocardial infarction. And that sounds complicated. That is what we call a heart attack. And that is where your heart hurts because your heart muscle is dying. And an MI for short, MI. And so you'll hear him talk about MIs if you watch emergency room TV shows. Oh, I think he's having an MI. And myocardial infarction is when the heart muscle begins to die because the coronary arteries get blocked. If things go well and the blood comes back from the coronary arteries, that blood turns blue as the heart muscle uses the oxygen to pump itself. And then this giant area, all the blue blood accumulates. I don't know if there's a second place where this blood goes. I don't know where that blood goes in. But over here, all this blue blood on the circumflex branch, these are all called coronary. No, they're not called coronary. They're called cardiac veins. And all these cardiac veins end up touching this big spot right here called a coronary sinus, which then this chamber right here, right about there, is the right atrium, which is where all your other vein blood goes in. And there's a hole in there where this coronary sinus pokes through and all the blood goes back into the heart. So it's cool. We've got models that we look at so you can see this stuff. So this big spot right here, coronary sinus. And all of these little guys are called cardiac veins. And so on the notes here, we've got the vein that all the cardiac veins on the surface of the heart drain deoxygenated blood back into before it goes into the right atrium. Those are called, the vein is called the cardiac sinus. The sinus is an empty chamber, like the sinus is in your face, behind your nose and above your eyes and stuff. And then the arteries on the surface of the heart are called coronary arteries. And ear-like extensions of the heart. So right here, these flaps that you see in class when we have real hearts, those flaps are sort of extensions of the atria, which you're going to learn about later, and those are called auricles. And I think they're A-U-R-C-L-E-S. It might be O-R, but I think that's a different kind of auricle. The bottom of the heart, down here, this tip, so this is an auricle. I'm just going to write A-U-R, auricle. Auricle, there might be an I in that word. I'm not prepared. This is called the apex down here. And so the bottom of the heart is the apex. And the last thing, the adipose tissue that the coronary arteries have. So if I had a yellow, I guess I'll use orange. I don't have a yellow, but this would really be yellow. But this orange stuff here, this is fat. And this is cardiac adipose tissue. So this is fat on the surface of the heart. That's because your heart never stops beating. And so if you go without eating for a while, your heart needs to have a nice supply of fat nearby to start draining fuel off of in case you're not eating. So every heart you look at is going to have a little fat right around its coronary arteries. Some hearts have more fat than others. It's not a bad thing to have some fat on your heart. So that's called cardiac adipose tissue. The adipose tissue, cardiac, adipose tissue around the coronary arteries on the surface of the heart. Okay, so those are things that you can see on the exterior of the heart when you look at it.